Hi, and welcome back to ENTP Life. Welcome to, I guess, one of my new sets. This is my office in Fort Lauderdale, where I'm launching my new home care company, AidBook. Now, I promised in a video before that I'd be doing a little more coverage on how to start a home health care agency. I did a video with my favorite nurse B a few months back, and I've been getting a lot of inquiries about, hey, I'm curious about home care, I know you're in the business, how do I get started? And I really don't talk much about my home care company here on this channel. And what I wanted to do was give you guys an inside look at how we're going to be progressing with starting our own home care agency and taking that as far as public offering. That's my vision for this company, is to grow it aggressively and be in a position to either be acquired by a major player within the field or go head to head with them and go public. Now, before we get started, if you're not already a subscriber here at ENTP Life, I highly recommend that you subscribe. What you're going to do is hit that subscription button and make sure you turn your notification bell on so that you get alerted of whenever we put out a new video. On this channel, we mostly talk about real estate, business, and then I get into anything else that I'm interested in at the time because, after all, I am an ENTP, so my focus changes severely from time to time. So you'll get sprinkles of other things that I'm interested in, and it's a good way for you to learn. So if you're not already a subscriber, please make sure you hit that subscription button. And of course, don't forget to like and leave comments or questions as freely as you want. I love engaging with you guys, so make sure you use that comment section below so that we're able to kind of give and take a little bit. Now, when starting a home care agency, the first thing that you want to take into consideration is what is going on in your local area. And the way that you're going to do this is by going to your local Department of Health website and seeing what are the criterias and the regulations surrounding home health care in your state. Now, in New York, there's two types of home health care agencies. There's what are called LICSAs and CHAs. And what it stands for is like whether you're licensed or certified, right? And it's home care agencies. But the main difference is that a LICSA is considered, I guess, like a Medicaid agency. They're not allowed to bill Medicare. So they're not doing that much of the skilled work or billing Medicare. And that's really the big difference. Now, the CHAs, or the certified agencies, are allowed to register and bill Medicare. And the difference is Medicare is a federal entitlement, and anybody who is receiving Social Security or registered as disabled, I believe, is able to also register for Medicare. And they tend to pay a little higher and be a little less, discriminating against services, okay? But the thing is, when you're dealing with a Medicare agency, those services are short-term. So this is like for people who are transitioning from the hospital, people who are post-operations, people who need skilled, intense care for a short duration of time. Now, on the other end, the licensed agencies, like what I have in New York, tend to focus on private payers, private insurance companies, HMOs, and managed long-term care for long-term services, okay? So you're gonna wanna look up what's going on in your state, how do they distinguish the two, and then you're gonna wanna decide, which one's for you. Here in Florida, for instance, you're allowed to have an agency that is either private duty or private duty and Medicare, which was surprising to me because I thought there would be two different licenses like they were in New York. So that was, something that I figured out by reaching out to people in the area, contacting the Department of Health, and really looking into the regulations of what is required to become a home care agency. Now, another thing with the Department of Health websites is they tend to have the application process, fee structure, and everything required if you're going to be setting up an agency. They'll also be giving out bulletins and information as to whether or not they're still issuing licenses. For instance, in New York, there's a hold or a moratorium on the issuance of new home care licenses or even the certified agencies. So you need to make sure that you know what's going on in your state and if you even have the possibility of opening up an agency. I know most states aren't in a moratorium state like it is in New York. It's a big business in New York, so they're a little overwhelmed with how many licenses they need to govern. So you're going to want to look into, what is the application process in your state? Are they issuing new licenses? Do they have a date on when that moratorium is being lifted, et cetera? Okay, so that's why it's important for you to be very familiar with the Department of Health in your state, because that's where the information is going to be coming from for home health care agencies. And it varies from state to state. Obviously, every Department of Health is managed by the state, so the regulations are going to change drastically from state to state. For example, in Michigan, I believe, there is no license at all. This Department of Health doesn't oversee home care agencies, so it's a free-for-all. So if you're in Michigan and you're thinking about getting started, there's a lower barrier to entry, which is pretty cool. Once you got your information on how to start your agency and what the state requires, the next thing is to really set your target and say, what type of agency do I want to be? Do I want to be an organization that's dealing with long-term care? Do I want to be dealing with skilled, high-tech nursing? That's like wound care, maybe like intrathecal medications, like for pain management. So there's a few different ways that you could go about it, but you have to determine what is going to be your area of focus, what type of agency are you going to be. And that's really your second step on how to proceed in becoming a home health care agency. It's important for you to know where you stand. Your third step is really going to be just sitting down and deciding how you're going to approach the application. Now, when we started our home care agency in New York, it was me and my mom. We got some help from my aunt, and we were just grabbing whatever policies we could from different organizations and kind of piecemealing it together. And it took us years to actually complete the file. And right now, the way I'm doing it is I'm seeking out a consultant. It's easier. It's costing me just under $50,000. They handle everything. I don't really have to think about it. Obviously have to give them some feedback as to how we're going to approach it. What is our initial structure going to look like? But they handle pretty much everything else. And it may sound like a lot of money, but compared to years of time that me, my mom, and my aunt really pushed for getting our license, I think it might be to your advantage to get the consultants, because they're going to also teach you some of the nuances of the business rather than you figuring it out on your own. That's my advice. I really wouldn't do it any other way, just because I feel like it's a waste of time. It's important for me to move quickly. But that application is most likely going to be on your Department of Health website, so you could download it, review it, and most of the time, the solution sets for your policies are written in their regulations. So you're really going to have to get familiar with the regulations of home care in your state in order to complete that application process. Now, the fourth step in getting started in your home care agency is probably the most important in my opinion, and that's building your team, okay? When you're completing the application, they're going to want to know who are the key players in your organization. They typically want you to have a director of nursing or a director of patient services, depending on the terminology that they use in your state. This person is going to be responsible for everything patient care related. This is the actual, nuts and bolts of the provisions of care, okay? That's a key player to have on your team, because they're going to need to know the regulations. They're going to need to be administratively strong. They're going to need to be strong in patient care, and they're going to be really the ones who are interacting with the state when the state is surveying, or the credentialing bodies when you're getting your recredentialing. So this person is a critically strong person. If it's you who's going to be the director of nursing or the DPS, make sure you have strong administrative skills, make sure you have strong leadership skills and management skills. If you don't have them, go take courses and get the skills that are going to be needed to run your organization. This is one of the most critical roles or positions in your team. If you're not that DPS or director of nursing and you're just someone who's starting this business, make sure that that person's competent just the way that I described, and that there's good synergy between you and them, okay? You're gonna wanna share the same vision, you're gonna wanna have the same mission for your organization. How far are you trying to take this thing, right? That's gonna determine what type of team you need in place. If you're only looking to get to, I wanna make my own money and I don't wanna be bothered by anybody, hey, you might not need that strong of a partner. But if you're trying to go to public offering, you're going to need some really strong players in your initial team and as you grow your team. So your team really matters. Another key position is typically the administrator, okay? This is someone who's non-medical, but is responsible for making sure that everything is operating according to the regulations, okay? Sometimes they're on the same level as the director of nursing, sometimes they're above, kind of supervising that work. You could kind of think of them as like a chief operating officer or one step below the CEO to make sure that everything within the organization is running as it's supposed to. Okay, so that's another key position. Obviously, you're going to want someone who's strong in human resources. The reason for that is because every patient you have is most likely going to have their own caregiver. So you're going to be hiring a lot of people, and the bigger your organization gets, the more important it is to have people who are really excellent at training, recruiting, and maintaining the legal compliance that's required for healthcare workers and workers in general. So when you're putting together that team, depending on how far you want to go, you want to make sure that you have somebody who's going to be able to oversee your personnel and make sure that everything related to employees is handled as good as possible. Another critical component of your team is going to be your marketing director, okay? Now, a lot of people, especially starting new businesses, don't think that marketing is important, which is kind of crazy, because it tends to be expensive and it tends to be somewhat ambiguous as far as the results, especially if you're just like kind of doing blast, like just basic canvassing where there's no data to track and say, well, how effective is one strategy versus the other? And it's something that people neglect when they're creating their initial team. Another thing is when you're doing the applications, they don't have a requirement to have a marketing director, so people skip it and don't think that they need to have that person on their team. They just look to target what's on the application. For example, on the application for Florida, I need to have a director of nursing, I need to have an alternate director of nursing, I need to have an administrator and an alternate administrator. It doesn't really say anything about, it actually doesn't say anything about marketing whatsoever, right? But I know from experience that you're gonna have to have a strong marketing team in place. So you're gonna wanna make sure that you have someone who really understands how to grow within the home care market. They're proven, they have experience, they know the players in the industry. You're going to want to have that person on your team as well. So now that we've gone through the research that's involved in learning the regulations in your state, putting together your application, figuring out what kind of company you want to be, and talking about your team, the fifth thing that you need to think about and really decide is, how am I going to fund this operation? Am I going to raise money? And am I going to use my savings, use my retirement accounts? How am I going to finance this operation? Now, one of the biggest mistakes that I made when starting the agency with my mom is that we were way undercapitalized, right? We had $5,000, right, in cash, and $50,000 of like loans, lines of credit, and kind of like buffer money, okay? That was way too little. And because of that, we ended up hiring staff that just wasn't good. We just, nickel and dimed everything, and that's really not the way to scale your business, right? If you look at any of these startups out there, or if you're familiar with companies that are getting started, they're going out there and they're raising, $500,000, $1 million, sometimes $20 million in their first round, depending on the industry group that they're in, so that they have an operating budget to execute on their plan. So a lot of us, especially coming from healthcare, we look at home care agencies as like the way out of the hospital, the way out of the job, right? And we just want to get the hell out of the organization that we're in and do our own thing. And because of that, we start undercapitalized and we don't really know much about business. And this is why I'm doing this post, is to really show you from an experience standpoint what to do and what to avoid, okay? So at this point, really think about where you're gonna get your money from. Now, you can raise capital from your friends and family. You could get it from your retirement account. You could go out to angel investors, which are people that you don't know who are interested in your sector, or you could try to raise money from venture capitalists. If you're just getting started, chances are that a VC firm is not gonna finance you unless you have really strong, relevant experience and maybe have done this before. Another option for financing is maybe going to a bank. Now, I don't really like going to banks for financing because they're too traditional, and when you're getting started, they're most likely not going to finance you, okay? You're going to spend a lot of time putting documents together to just get rejected on your initial, raise. Chances are you're going to do a lot better raising money from friends and family, people who are in the industry like physicians, social adult daycare owners, maybe people who sell durable medical equipment, people who understand this niche may be willing to put some money up and get some exposure to this type of business, right? But that's why I preface this by saying you need to have a strong team. Because when people are looking to invest in your company, they're going to be looking to invest in that sector because they think it's sexy. They're going to want to invest in the people behind the business, right? Just because you're in home healthcare and you have a license doesn't mean that you're going to make money. It means that you have the license to operate, right? So there's a difference between a poorly managed company and a well-managed company. And the people who are running that company are the difference between the two, okay? So having a strong team, as I described before, is important when you're looking at getting money. Now, how much money do you need? It really depends on the state and what kind of operation that you're going for. For me, I'm seeding this new company with $100,000 because that's kind of what was recommended by the consultant. But that $100,000 will burn very quickly. And I'm not drawing a salary from that. I don't care to draw a salary from that. That money is just for operational expenses and to prove my concept here in Florida is highly scalable. Once I have my proof of concept established here and I have the traction in the data, then I'm going to market and I'm going to be raising anywhere from $1 to $3 million to expand within the state. So now that your application is in, your team's assembled, and you got yourself some money, it's time to move on to step number 6. Step 6 is all about executing on your original plan. Remember I talked about what type of agency do you want to be, right? That's not only what type of license you want to hold, but what size are you trying to get to, right? If you're going to be that mom and pop organization, there's nothing wrong with that. If that was what you were setting out to do, then execute on that really well. Maybe you were thinking about getting to that mid-size point. Maybe you want to have between 300 and 1,000 patients, right? That's a pretty solid organization. It's going to make you a few $1 million a year, and that's where you want to be. Execute on the plan that you had in mind from the beginning, okay? You don't just approach this haphazardly. Create a roadmap that you could follow that's going to lead you to the patient base that you have in mind for your organization. Create, a detailed organizational chart of who you need to be and what your company would need to look like to get to the size that you're looking to get to, okay? Same thing with the public offering. It's so important that you actually execute on these ideas because it's going to be what allows you to, 1, make money, 2, raise money, and 3, stay in business, okay? So it's very important that you actually deliver and execute on the concepts that you had in mind and the business plan that you created. Now, the 7th and last step that you have to kind of take into consideration when starting your home care agency is self-reflection, okay? It sounds kind of silly, but this is something that I see that a lot of people are missing or a lot of organizations are missing. Everything is not going to work as you planned, okay? You may not raise the amount of money that you were looking to raise. Market conditions may change as you got started. Hey, anything can happen, but you need to be able to actually step back and really review what's going on in your organization and pivot accordingly. You may actually be having opposite results. You may have projected that, hey, you're only shooting for 100 patients, but within 4 months, you're already at 100 patients. Why are you going to stop then? You might have to reevaluate your strategy and say, should I be looking for more? Should I be looking to get bigger? Or should I kind of refocus myself so that I'm staying at this 100 level because I don't want to get sloppy. I want to make sure that these 100 patients are getting the best service possible, okay? You need to have some sort of self-reflection in this entire process when you're getting started. Because if not, you may be building an organization on a shaky foundation. And if you haven't even started providing services and you're somewhere in the licensing process and you're just kind of in limbo, this 7th step is also critical because it gives you time to look back at your business and say, where could I potentially be going wrong? Is there somebody on my initial team that's not pushing the way that I want them to push, or is not performing according to the role that they have? And it might be a good time to look for a replacement, even before you get your boots on the ground and start providing services in the field. You might want to reevaluate your team and kind of redistribute things. Another thing that I wanted to just say as kind of like a bonus piece, if you're the founder of this organization, don't just haphazardly give shares up to partners, right? I see a lot of people, and this happened in my organization as well, that you start your company and the way that shares are distributed were just kind of like arbitrarily done, okay? You might find yourself with a partner that you can't get rid of, right? Or you might find yourself in a situation where you want to raise money, but people aren't looking to give up their shares. If you're the founder, or there's a few of you who are founders, have a contingency in place that says, hey, there's going to be a certain amount of fundraising, or you're going to have to decide that on your own, but there's going to be a certain amount of money or a certain amount of equity within our company that may have to be sold. And if you're using a partnership or share distribution as a way of attracting talent, make sure that you're not like front loading that share distribution. You want to make sure that you vest them over time, right? This is just a tip based on my own experiences. Really, you don't want to give away your company for too little of a contribution or too little money. Don't go out and raise $100,000 and for $25,000 give up 25% of your company. Absolutely not. That's stupid, because that person who gave you $25,000 to help you start your business has 25% of your company. What if your company is worth $100 million one day? Was that $25,000 worth it? Could you have maybe gotten a credit card and swiped $25,000 to yourself instead of taking on a partner for such little money and such big equity? So when you're raising that money, or when you're thinking about partnerships, really study the startup models, because they have really good structures for how to distribute shares and how to raise money, how much equity you should be giving up in exchange for cash, etc. So I know that might be a little more than what you want to hear and understand when starting out your home care company, but I want to give you guys an inside look as to how the different types of organizations may approach it. You might be thinking, hey, I just want to get started, okay? And that's fine, but at least you know now that there's a bigger target out there. How do I get money? How do I raise money? How do I look at forming a team and surrounding myself with the people that are really going to help me grow, right? I don't want to just say, go out there and start it. Now, what you're going to see going forward through this series of how to start a home care agency is how I'm approaching it, okay? So now that you have the bare bones of how do you get started, I'm going to be showing you what my process is and my journey. And what you're going to see oftentimes is a lot of that seventh step, a lot of that reflection, thinking about what's happened, thinking about how I have to reposition myself. And I hope that you guys who are out there taking the chance and starting your own agency, that you're able to learn something from my experience, okay? So that pretty much ends this How Do You Start a Home Care Agency, episode 1. And I hope that you've enjoyed it. If you have any questions at all about anything that I've said, please leave it in the comment section below. Just reach out to me. I usually answer within a day or two, sometimes within minutes. So any questions are welcomed. And if you haven't liked this video and you made it to the end, please give me that like. It really helps out a lot. Don't forget to share this video if you have friends who are interested in getting started in home care or starting a business. Sharing is caring here at ENTP Life, so please share. And once again, make sure you subscribe, turn that notification bell on, and can't wait to talk to you again. Take care.